Cancer. It's a word that evokes fear and uncertainty. But understanding this complex disease is the first step in fighting back. Simply put, cancer is a group of diseases characterized by uncontrolled cell growth. These abnormal cells can invade and destroy surrounding tissues and organs. The ability of cancer to spread, known as metastasis, makes it particularly dangerous. Cancer is a leading cause of death worldwide. However, it's crucial to remember that advancements in screening, treatment, and prevention have significantly improved survival rates. Early detection and treatment are paramount in the fight against cancer. Understanding the basics of this disease can empower individuals to take charge of their health and make informed decisions. Cancer can manifest in a myriad of ways, and its symptoms often vary depending on the type and location of the disease. While experiencing these symptoms doesn't necessarily mean you have cancer, it's crucial to be aware of potential warning signs and seek medical advice for any persistent or concerning changes in your body. Some common symptoms associated with cancer include unexplained weight loss, persistent fatigue, lumps or swellings under the skin changes like unusual moles or sores that don't heal, and changes in bowel or bladder habits. Other potential signs include persistent cough, difficulty swallowing, hoarseness, unexplained bleeding or bruising, and persistent unexplained pain. Remember, early detection is key. If you experience any of these symptoms, consult your doctor promptly. At its core, cancer is a disease of the genes. It begins with changes or mutations in the DNA within our cells. Our DNA, the blueprint of life, contains genes that regulate cell growth and division. These genes ensure that cells grow, divide, and die in an orderly fashion. When these genes mutate or change, it can disrupt the normal life cycle of cells, leading to uncontrolled growth and the development of cancer. Mutations can cause cells to ignore the usual signals that tell them to stop dividing or to die when they should. These mutations can be inherited from our parents or acquired throughout our lives due to various factors. Inherited mutations are passed down through families, while acquired mutations can result from environmental exposures or lifestyle choices. Inherited mutations account for a small percentage of cancers, while acquired mutations, often triggered by environmental factors or lifestyle choices, are far more common. Factors such as smoking, excessive sun exposure, and certain chemicals can damage DNA and lead to mutations. These mutations can affect different types of genes, including those that promote cell growth, suppress tumor formation, or repair damaged DNA. When these critical genes are altered, the balance of cell growth and death is disrupted. When these genes malfunction, cells can grow and divide uncontrollably, leading to the formation of tumors. This uncontrolled growth is the hallmark of cancer, and understanding these mutations is key to developing effective treatments. While anyone can develop cancer, certain factors can increase your risk. These factors can be related to your lifestyle, environment, or even your genetic makeup. Understanding these risk factors is crucial in taking proactive steps towards prevention. It's important to note that having one or more risk factors doesn't guarantee you'll get cancer, and many people with no known risk factors develop the disease. This means that while risk factors can guide us, they are not definitive predictors. Age is a significant risk factor, with most cancers diagnosed in people over 55. As we age, the likelihood of genetic mutations increases, which can lead to cancer. Family history of cancer can also increase your risk, especially if multiple close relatives have had the disease. Genetic predispositions can be passed down through generations, making it important to know your family's medical history. Lifestyle choices such as smoking, excessive alcohol use, and a sedentary lifestyle can significantly elevate your risk of developing cancer. These habits can lead to changes in your body's cells, making them more susceptible to cancer. A diet low in fruits and vegetables and high in processed foods is another major contributor to cancer risk. Eating a balanced diet rich in nutrients can help protect your body against various types of cancer. Other risk factors include exposure to certain viruses which can alter the genetic material in your cells, For instance, human papillomavirus, or HPV, is known to cause cervical and other types of cancer. Vaccination can help reduce this risk. Similarly, hepatitis B and C are viruses that can lead to liver cancer. Preventative measures such as vaccines are available to lower your risk. Understanding your risk factors and making healthy choices can significantly reduce your chances of developing cancer. By staying informed and proactive, you can take control of your health and improve your odds. Cancer and its treatment can lead to various complications, impacting physical and emotional well-being. These complications can arise from the disease itself or as side effects of treatments like chemotherapy, radiation therapy, and surgery. Common physical complications include fatigue, pain, nausea and vomiting, hair loss, weakened immune system, and an increased risk of infections. Cancer can also lead to emotional distress, anxiety, depression, and financial challenges due to treatment costs and potential loss of income. Long-term complications can include heart problems, lung damage, infertility, and an increased risk of developing secondary cancers. Managing these complications often involves a multidisciplinary approach, including medications, therapy, and supportive care to address physical and emotional needs. While not all cancers are preventable, adopting a healthy lifestyle and making informed choices can significantly reduce your risk. Prevention strategies focus on mitigating modifiable risk factors and promoting overall well-being. One of the most impactful steps is to quit smoking and avoid secondhand smoke. Maintaining a healthy weight through regular exercise and a balanced diet rich in fruits, vegetables, and whole grains is crucial. Limiting alcohol consumption and protecting yourself from excessive sun exposure are also essential. Regular cancer screenings, such as mammograms, colonoscopies, and Pap tests, can detect cancer early when treatment is most effective. Vaccinations against HPV and hepatitis B can also prevent infections that can lead to cancer. The field of cancer research is constantly evolving, with scientists and clinicians making significant strides in understanding, diagnosing, and treating cancer. Recent breakthroughs offer hope for more effective treatments and potential cures. Immunotherapy, a revolutionary approach that harnesses the body's own immune system to fight cancer, has shown remarkable success in treating various cancers. Targeted therapies, designed to attack specific molecules involved in cancer cell growth, are also showing promise in improving treatment outcomes. Advancements in genetic testing and personalized medicine allow for more precise diagnosis and tailored treatment plans based on an individual's unique genetic makeup and cancer characteristics. These breakthroughs offer hope for more effective, less toxic treatments and improved survival rates for cancer patients. The fight against cancer requires a collective effort from individuals, healthcare professionals, researchers, and policymakers. Each of these groups plays a vital role in the battle against this formidable disease. From the doctors and nurses who provide care and support to patients, to the researchers who tirelessly work in laboratories seeking new treatments and cures, every contribution is invaluable. By understanding the complexities of this disease, we can empower ourselves and future generations to make informed decisions and advocate for progress. Education and awareness are key components in this fight. When communities come together to learn about cancer, they become stronger and more resilient, seeking prompt medical attention for any concerning symptoms. Supporting cancer research, participating in clinical trials, and advocating for policies that promote cancer prevention and early detection are crucial steps in advancing the fight against this disease. Together, we can strive for a future where cancer is no longer a life-threatening disease, but a manageable condition. Celebrating the victories, no matter how small, and sharing stories of survival and hope can inspire others to keep fighting and never give up. By working together, we can make a difference in the lives of millions affected by cancer worldwide. Unity and collaboration are our strongest weapons in this battle. Let us join hands and hearts to create a world where cancer is no longer a threat, but a challenge we have overcome. Thanks for exploring cancer symptoms, causes, and prevention with us. If this helped, subscribe to Everwell Life for more health insights. See you next time.